Okay, hi, my name is Callie Boyer. I'm the Director of Marketing here for Promises. And Promises is a full spectrum network of residential treatment centers with outpatient, telehealth, and all those things. And I will give more background on that in a moment. But this year, we also started having these family webinars. We find that it's really important to include the families in our curriculum and inviting you all to be here so you can better support and communicate and connect with the people that you love. So tonight, our topic is going to be not, this one is not it, right? Aren't you doing motivational interviewing?
I am, yes.
Maybe click the next one? No, maybe I just did that wrong. Okay, Michael is talking about motivational interviewing for families tonight. I had the
That's
wrong
right.
title. You're like, oh no, I did not prepare for that.
Yeah,
Um, Okay, so Michael is speaking to motivational interviewing. So if you were also like with our PBHU group last month, we've actually been doing motivational interviewing on the clinical side. We're doing that again next week. So it's a whole series of motivational interviewing for these couple of months. Um, Michael has been with Promises for how many years have you been with us?
it'll be two in June.
It feels like it's been much longer than that. You've spoke
Yeah,
many times with PBHU, so I'm really grateful that you're here with us this evening. Michael has over 20 years of experience in the substance use and mental health field, and he right now serves as our executive director for Promises or the Ranch, Pennsylvania's outpatient program. So he oversees the PHP and step down programs that come from the Ranch, Pennsylvania. You can go to the next slide. Great. So, to give a bit more background on Promises, I'm sure a lot of you that are families are aware of our network, but just so that you have a bit of a background or want to send any resources or information to other people, we have 7 residential treatment centers across the country in Texas, Tennessee, Georgia, Pennsylvania, and Massachusetts. We have residential care, outpatient care, partial hospitalization care, and telehealth. So even if you are sitting here tonight with a loved one in Tennessee, just know that those programming might look differently at Atlanta or Houston, but the curriculum and the dedication to our patients is the same. So while Michael leads a very different program in Pennsylvania, the curriculum is the same, and the tools that we teach are still applicable to those in Atlanta or Texas. If you have any questions or want to learn more about any of our programs, you can just email familyservices@promises.com. I can set you up with a tour. I can share some resources. So you may even have noticed that we have some news segments going on about how to start conversations with your loved ones going on in Atlanta right now. So I'm also happy to share, just more dedicated mental health related topics as it is Mental Health Month. So I'm happy to share those resources if you need. Again, familyservices@promises.com or just send me a message in the chat. You can go to the next slide. So every Tuesday, we're hosting these family support trainings. This happens every month. And then the third Tuesday of the month, we have family support groups. This is going to be more of an open space. So if you're sitting here tonight, maybe you're marinating on the information from this evening, you have some questions that come up. Next Tuesday, you would come into our family support group, and it's not recorded, it's just a space for families to ask questions. It can also just be on like questions around treatment, questions around admissions or insurance, your loved one's day to day. We are happy to just bring some clarity to treatment and make that as transparent as possible for you to just join and ask questions. And if you don't have a loved one in treatment with Promises and you have questions, you can still show up and ask those there. So we're happy to support you. And that's going to be again third Tuesday. So next Tuesday, May 19th at 5 o'clock. You do have to register for that separately. So I will pop that link in the chat here just in a minute. I think I just have one more slide, Michael. Okay, so next month, we do have another family webinar. That one is going to actually be from our another therapist at the Ranch, Pennsylvania that works closely with Michael. Jake is going to be speaking to what's called the window of tolerance. So if you're not sure what that means, it's essentially, and Michael can correct me if I'm wrong, but there is a regulated state in which like we exist. And if you get out of that regulated state, either with maybe appearing as anxious or numb. That window is where we like to stay to better connect and communicate with our loved ones. So that's just to give you a little bit of background if you don't know what a window of tolerance is. And next month, Jake's going to really do a deep dive in how understanding that window of tolerance is such an effective tool to connect with your loved ones and just understand more about yourself too. And that is going to be same time, 5 o'clock that Tuesday. So, all
Great
right,
job, Callie.
that's it. Thanks. I'm passing this over to you. If any of you need anything in the chat, I am here. I believe there's a Q&A that's open, but we're not really going to be using that tonight. Any questions that you have, just put them in the chat to Michael. You also have the ability to raise your hand. So if Michael, if you see that come up, just, we're inviting you all just to speak up if you have questions as he goes through, or you can put it in the chat. Okay. Thank you all for being here.
All righty, let me share my PowerPoint here real quick. So, all right, excellent. So, as Callie mentioned, that my name, is Michael Fangio. I've been in the field for, about 20 years. I have been working in a lot of different areas in the field, inpatient, outpatient, private practice. I'm a certified advanced drug and alcohol counselor. I'm also a certified clinical trauma professional and a certified clinical supervisor. I supervise counselors and therapists to get licensure and in practice and things like that. I have been doing lots of family education groups and support groups over the years. Very passionate about connecting with families to help support loved ones going through the process. I'm also a person in long-term recovery myself, and I'm definitely open to sharing that with people, my own experience, and then also I draw a little bit from my family's experience and their support through it with myself. I am a father myself. I have three young children. And so I understand the importance of education on family matters, especially when it comes to sensitive topics and difficult situations. And so I enjoy connecting with families often and love to be able to be a support for them in order to help them get, learning how to support their loved ones even more because they're going through a very difficult process. So today we're going to talk a little bit about motivational interviewing. Motivational interviewing, or MI, is a form of therapy that we use. It's evidence-based, and basically it's a form of therapy that we use to help uh, draw out the motivation from our clients to help them keep moving forward. Basically, this is a process that we use that helps to push along or to support, encourage, guide, work with our clients to kind of help them continue in the progress that they're making when it comes to behavioral health treatment, whether it's substance use challenges or mental health challenges or things like that. There's some tenets to therapy that we're going to talk a little bit about, and but really this is kind of just a general overview. Basically, this is and there will be some techniques that you might be able to take away that you could probably possibly use when you're talking to your loved ones, or this could just be education and understanding on what are some of the approaches that we use while we're working with your loved ones in a treatment setting. And so, yeah, so let's talk a little bit about motivational interviewing. So, supporting a loved one through substance use and mental health challenges. We're going to talk a little bit about what MI is, understanding how it works. We're going to learn how communication impacts motivation and resistance. We're going to recognize common family interaction traps and practice simple. We might not get to the practicing MI communication tools, but I'll share a little bit with you. And of course, we're going to talk about how to support change while maintaining healthy boundaries. Okay. So, first of all, let's talk a little bit about what are some challenges you face when trying to help someone you love? I don't know if anyone wants to put that in the chat. I can read them off if anyone wants to share a little bit about some of the challenges that we might be facing here, working with or helping our loved ones. Any thoughts on that? Denial. Someone wrote in denial. Yeah, denial can be a big one. Um, we want change more than they want change. Another person wrote that in. Yes. Deflecting, denying, or lying, that definitely happens in these types of situations. Resentments, yeah, resentments can build. Hmm. Wanting to focus on a job instead of working on the addiction. Yeah. Clients are not ready. Hmm. Shame, guilt, absolutely. Afraid of sounding judgmental. Hmm. Okay. So these are all very typical responses to this type of question. And these are all things that we can help with motivational interviewing. Motivational interviewing basically is, you know, working with a client and to try to again draw out the motivation that they have with them and using non-confrontational language while at the same time holding our boundaries, and that can be very tricky, to hold our boundaries, to hold our position, and be firm with what it is that we need to stand on, but at the same time trying not to provoke or generate more conflict and this idea of resistance. And we're going to talk a little bit about resistance and what that is. And a lot of times, um, our clients, when they may hear these things, or we may say, "Hey, you're in denial. You're lying. There's resentment here." Those are all kind of like triggering words, right? And what happens is our loved ones, when they hear that, they kind of put up the walls even harder. They dig their heels in the sand even more. And so we're going to talk a little bit about um, what it means to kind of um, to be able to break those walls down, to bring those walls down. There's something called ORS that I'm going to talk a little bit about, and that is getting is open-ended questions. I want to kind of share a little bit about what ORS are here for a second, but ORS is a very good approach in motivational interviewing to help you to be able to have these conversations with our loved ones, but to also help to disarm them a little bit so that it isn't so rigid and so there isn't so much pushback on that. And so ORS stands for open-ended questions, affirmations, reflective listening, um, summaries, and that's what it is. And then summarizing what we're saying. And so we're going to get into that a little bit here as we go and how we can kind of do that stuff. Um, sometimes when we're lecturing, nagging, or we're debating, threatening, or even rescuing, it can backfire. Clients can become defensive, they can argue, they can withdraw, trust decreases. And so we want to be mindful of that and kind of try to be able to still get across what we're trying to do, the support that we're trying to give, but at the same time to be able to flow with the client for that internal motivation. A lot of times when I'm talking to my staff and we're kind of talking about some of these defensiveness approaches that are happening with our clients, I like to point out the fact that, well, hey, our client is here. They're in treatment. I mean, that in itself demonstrates some motivation. Why are they there? Now, a lot of times that motivation can be external versus internal. And in the field, a lot of times we're looking to turn external motivation in on itself, to turn it and help the client create that internal motivation for change. Some ideas for external motivation are kind of like the legal system. A lot of times people may be like on probation, they may be arrested, they may be needing treatment for those types of things. That can be an external factor. Families can be an external factor with ultimatums and things like that, which again, most people um, start in the process of change through external motivation. There's always external motivation factors to generate that desire to want to change something, right? So that's kind of what we're talking about here. The idea is how do we help the client understand that those external factors are all connected, and that really the internal desire to want to change is to better their life completely, in entirely, in every area, every factor. And that's how clients can take those external factors that are motivating them for change, and to turn it to internal. And so we want to look for those driving forces. What is that motivation, whether it's external or internal, and how do we help draw it out of that client so that they can understand that that they start um, understanding that change is, really kind of where they want to be and where they want to go. And you'll start to hear that in the way they talk. And there's something I'm going to talk about where it's called change talk or stay talk. And you start to hear their kind of dialogue change a little bit when they start to realize that this change is a really good thing for them. So why is change hard? So here's some ideas about change. Clients are ambivalent sometimes. I want to stop, but I don't want to stop, or I want to stop for this particular thing, but I don't want to stop because of this. I want to stop because I don't want to go to jail, but I don't want to stop because I'm going to be bored all the time, and I still want to have fun. I'm still young. I'm that type of thing. So, it's very important to understand this ambivalence that is happening with our clients, and to try to figure out how to navigate that. Another reason why it's hard to change is fear. How is my life going to be? I've been living this way for so very long that I don't know how to live any other way. And so the fear of the unknown, fear of change, shame, which was mentioned already, shame can make it very difficult to want to change. There could be a lot of mental health symptoms, that make it difficult to change. Anxiety can be very uncomfortable, sleep problems, appetite or eating problems. There can be a lot of other types of emotional disturbances like anger and depression and things like that. And a lot of times change and transition for a time can exacerbate those issues and make them worse. And clients oftentimes want to avoid that. They don't want to avoid their condition getting even worse for a time. And so they try to avoid change because of that. And then, substance dependence. That can be a reason why change can be very difficult because of the physical withdrawal that a person can go through, or, just not having that comfort of that substance with them can be very, very difficult. What are some of the reasons that you think or that you've heard that change is tough from your loved ones? Throw that in the chat. Family is the problem, not the client. Sure. Yeah. They could be deflecting. Loss of trust. Yeah. Loss of trust can be a big one. That was what someone said. Fear of fully feeling and dealing with their trauma. Yes. Because once you have to step into that, all kinds of feelings come out, and they're not good. They're painful. They're uncomfortable. So yeah, dealing with that trauma. Confidentiality of meetings, sure, and that comes down to stigma too. Confidentiality and stigma are very closely tied together. And a lot of times we don't want everybody to hear our laundry. We want to work through it, but we don't want the neighbors or other family members to really know, because then there's stigma attached to it. They're going to talk to us a different way. They're going to look at us a different way. So that can be confidentiality, and trust can be a difficult thing. Um, if I'm not this, then who am I? Yeah, so that identity, that really speaks. Someone wrote in the chat, if I'm not this, then who am I? And really that speaks to our identity. Our identity gets so tied into either our substance use and that lifestyle that is a part of that. And there's so much of culture and lifestyle attached to substance use issues, or even sometimes with like depression and withdrawing, and always being isolated. But that becomes their identity, that they're just kind of recluse, and like, I don't want to have to go out and talk to people anymore because this is who I am. I don't need I don't need to go out and socialize and things like that. A recluse is fine with me. And still changing that becomes their identity. And then denial. Yep, denial was mentioned a bunch of times. I don't have a problem, so why would I change anyways? And so denial is it can be a very challenging thing. A lot of times, as a therapist, when we're working with denial, I just kind of start with, okay, then what brings you in, and why do other people think you have an issue, and what is the problem with that? If there isn't a problem, then there's not a problem. Then we don't need to talk about it. But a lot of times, it kind of goes back into like relationships. Okay, well, the problem is that they believe this. Well, all right, if they believe that, is it causing some relationship conflict? And what's going on there? And how do we improve the relationship? And do you think you're drinking, if, like, let's just say hypothetically that if you cut down on drinking, would that improve your relationship? And if they said yes, then okay, well, how valuable is that to you? Is alcohol more valuable, or is that relationship to you? And, kind of having those types of conversations, whether they feel like they have a problem or not, we start bringing it off of the focus of like, oh, it's just alcohol and it's just you and the problem. And we start bringing it to like their relationship challenges or emotional challenges. When you drink a lot, you seem to be upset and angry and maybe violent or aggressive or things like that. Is that something that you may want to change? And if so, then why? And maybe we want to explore that. Maybe taking a break and see how it would go. Those are kind of types of like soft landing type things that we can have those conversations with. Another person wrote, the answer to the question I get most often is I don't know. And so, if we, yeah, if we're asking our person why it's so hard for them to change and they say, I don't know, that's a lot. That's really a big part of why treatment is so important, because a lot of clients don't know this stuff. It may be simple for a lot of people, it may seem simple, just stop drinking, but there really is a lot more going on internally and underneath that clients need professional help to start to work through and unpack and explore how they can come to the understanding of what it is that is making it so difficult for them to change. Usually, it's a number of things. It's not just one thing, and we always try to simplify things because it helps us make sense of it. But it doesn't. We can't simplify addiction or mental health challenges. The question of what is most important to you, the addiction or the relationship. Yeah, maybe I get that. That's what someone was responding to. Sure, they might not know at the time, and sometimes it just, unfortunately, it may take a while for a person to really understand that, what it is that's most important for them, and that we can, again, professional help helps a person prioritize and understand what is the priorities in their life. What about relationship in general? We can talk about what relationship is. Can we just live by ourselves in complete isolation? And the answer is no, we can't. We need each other, and we need to interact with each other. A lot of times we talk about, well, how does it feel when other people treat you this way or look at you this way? That is a relationship type of aspect and things like that. So yeah, this can be very confusing. Change can be very confusing. Substance use, mental health, and all that type of stuff. It can be very difficult for our clients. Um, So one thing that we want to talk a little bit about is when clients are changing, or when we feel that a client needs to change, we want to talk about this idea of responding to resistance, and how do we do that with not escalating the resistance, but minimizing it, by diminishing it. And a lot of times it has to, there's this, idea of rolling with resistance or going with the resistance, avoiding the reflex to have to jump in because our emotions are high, our feelings are there. We want to really think about de-escalating and just supporting our loved ones through the natural process of change, especially if they're engaged in a therapeutic process. And that's, we're going to be talking, tonight. I'm talking about that a few times. Is the therapeutic process is key. A lot of this is in the understanding that our clients are engaged in the therapeutic process. As Callie mentioned in the beginning, right now I'm the executive director of our outpatient services in Pennsylvania. And so usually that's kind of like a reintegration type of process or program. A lot of times the clients that come into our outpatient program, have gone into a residential program for a little while, and then they're stepping back out and they're reintegrating, and we're kind of helping support them back into the community. And so when a person is in that therapeutic process, we have to start to trust the process. We have to try to understand that it is a process, and it's a long process at times. Research shows that a person that needs a residential level of care, that is approximately like a 30-day process. But then it takes up to their stages, and it takes up to 9 months or so to get really good success rates or outcomes for the process. So we're talking about like a 9 month year process for most people. And a lot of times we feel like we don't have that time, or there's a sense of urgency, or there's disrespect happening. And so we jump into that. And in reality, we just got to slow everything down and allow the process to happen with professional help. Practical conversations at home that we can have. We can start talking about, what is mental health, getting educated on mental health, really learning more about it. That's partially what this family webinar series is to provide some education. I also want to highly encourage you all to get as much education as possible on what mental health is. What is substance use issue? How does it affect the brain? How does it affect the physiology of a person and things like that, your emotions and things like that? And I think the more that we understand mental health and substance use disorder, that we can learn that we can have a different perspective on how to help our loved ones. And then the idea of healthy boundaries versus enabling. I want to talk a little bit about that. What are some things that we may think about when I say healthy boundaries versus enabling? What do you guys think about that? Like, what would be a healthy boundary and what would be enabling? Anything? Any ideas on healthy boundaries versus enabling? Not allowing your loved one to verbally abuse her. Yes, that would be a healthy boundary. Respect, a reinforcing respect and respectful communication. Doing for them what they can do for themselves. That, yes, that could be um, enabling. Saying no can be a healthy boundary. Yeah. So the idea is enabling is when if you were to set a boundary, or you feel like a boundary should be in place, but you don't enforce it. you know and it can be keep giving them money, right? Money that they're using for things that aren't healthy for them, not necessarily paying bills, although that could be enabling sometimes as well. But if they use that money for something that they weren't intended to use, being dishonest and things like that, then we need to set boundaries with them and help them understand that this is it's not okay. We have to help teach what is appropriate, what is not appropriate way to be treated for our loved ones. And that can be very tricky. And it looks very different for everybody, for different people, different levels of where people are and things like that. But yeah, we do want to understand what the difference is between enabling and setting up boundaries. And there's a lot of really great resources out there that you can use, you can explore to help you understand what it would look like to setting up healthy boundaries, because it does look different for every family. So, motivational interviewing is a collaborative, person centered style of communication designed to strengthen a person's own motivation and commitment to change. And so that's kind of the idea. What we're doing is we're collaborating with them to help strengthen a person's own motivation and commitment to change. Because there is usually some type of motivation there for change. You just got to kind of dig in and get it. What MI is not is arguing, convincing, threatening, fixing, controlling. We want to be careful about those types of things. What it is compassionate. It's curious, it's collaborative, it's respectful, and it's hopeful. And that can be very difficult. A lot of times, we kind of lose hope in this process. And what I would suggest for family members is to continue to go to support groups and to get, some support yourself in order to have that hope. Because if once we lose the hope as our family members, then our clients definitely feed off that hopelessness. And so we got to find a way to be able to get support for ourselves to keep that hope. And then this idea of curious questioning or curious exploration of like what it is going on. That is another thing that's really, really important in motivational interviewing. It's just to stay curious, like how is that working for you? Like, what is it that you love about doing this or don't doing this? What is it you don't like about doing this or don't doing this? Those types of questions that we kind of ask, we ask those when we start to get to know our clients in the beginning to help draw out what it is, those things that they're getting from either the substance use or the emotional challenges, and what is it that is challenging for them. And it could be a lot of different reasons depending on what's happening. So you want to think about that. So our natural instinct, right? Our natural reflex sometimes is if I care, I should fix it. Like we as family members feel like we need to fix this person. We need to make this person change because they're ruining themselves, they're ruining the family, they're ruining everything. And so I have to fix this. And common examples of when we respond that way is that we'll get into lecturing. We'll get into nagging, we'll get into debating and threatening, and then we'll get into rescuing. Like, okay, they can't do it for self, they can't pay their own rent, so I got to go pay it for them. They can't provide food for themselves, so I got to go provide it for them. And that can be very difficult. It can backfire. And this is the reason why that type of stuff backfires. When people feel pushed, they become very defensive. I'm sure you guys have experienced this with your loved ones when our clients, when your loved ones feel pushed, they'll become very defensive and dig in their heels. They'll argue back. They'll withdraw and just kind of, distance themselves. Trust decreases. And so we want to be careful about those types of things. People are generally better pursued by reasons they themselves discovered. So this is a great quote that people are generally better persuaded by reasons that they themselves discovered. So we want to be exploratory with them and curious with them, helping them to discover for themselves why change is good. And that's kind of like the whole emphasis of motivational interviewing, is that we're helping them explore and discover and identify and develop that within themselves. And sometimes it's a very difficult, very slow process to have that happen. So, core principles in that is partnership, work with your loved one, not against them, acceptance, separate the person from the behavior, compassion, lead with care over control, evocation, draw out their own reasons for change. And sometimes we have to dig pretty deep to find them, but usually they're there. So here's some examples. Instead of saying you need treatment, we could try something like, what concerns you most about how things have been going lately? Those types of things. A lot of times it's difficult to be able to say things like this, especially in the heat of the moment. That's why a lot of times if we feel like we're in an emotionally charged conversation with our loved one, if it's like really heated, we really should step back from that. And we should find a time to have these types of conversations with them when we're both kind of at a regulated emotional state, and it becomes much more effective. And then let's talk a little bit about OARS, the open-ended question, affirmation, reflective listening, and summaries. So OARS is a big part of motivational interviewing. The first part is open-ended questions. And you want to avoid a yes, no question. Like, do you feel like you have a problem? Yes. Do you think you can ever stop? No. Do you think that you're hurting the family? Yes. So we want to be careful about using yes, no questions. Instead of saying, are you okay? We want to try, what's been hardest for you lately? You know, things that where they have to generate a response. You can't really say yes or no when I ask someone, what's been the hardest for you lately? They have to kind of explain it to me. And as we're talking and dialoguing with each other, there's different parts of the brain that are fired up. that help us explore things in a deeper way. And it becomes that's what is so helpful with motivational interviewing is we go deeper rather than just surface level, defensive, yes, no, get out of my face type stuff. We wanted to help them understand, hey, well, what's going on with you? And it also shows that we're trying to connect with them relationally, also, which can be a challenging thing for our loved ones. So that's the open-ended questions part. The next one is affirmations. So as we're asking open-ended questions, we also want to provide affirmations. We want to recognize strengths for our clients because as we recognize those strengths and we encourage those strengths, what happens? Well, what happens is the defensiveness lowers. We want to bring that defensiveness down so that we can see that we can work over that wall. That defensiveness level is up here. It's a huge wall, a huge barrier right in between me and my loved one, and you're not going to be able to, nothing's going through that barrier. And so the whole idea is to bring that defensiveness down so we can get up over it and start to have that conversation where we can really get through to our loved ones. Until we're able to do that, it doesn't matter what we say or what we do, that wall, that barrier is impenetrable. And so the idea is to bring it down. And so this whole idea about ORs, open-ended questions, affirmations is really, once you start providing some encouragement, some strengths, and recognizing those strengths, when there is a moment of honesty, yes, maybe there's a lot of lying, a lot of dishonesty, a lot of denial, but look for those moments when there is, even just for a second, and recognize it because we are pretty quick to recognize the denial. But a lot of times, and then we sell our person off for if they are doing, if they're lying a lot, then they're a liar, and then they take on that identity, and then those walls come right up. But yes, they may be lying a lot, but I guarantee if you talk with them enough and if you connect with them and you observe enough, there's going to be some times where they're being truthful. And then you want to be quick to point out the truthful stuff and encourage that just as quick as we are to point out the denial and the lying and the resentment and the anger and all that other negative stuff. Because if we're quick, just as quick to point that stuff out, it offsets the balance and it starts bringing that wall down. And so if there is an honesty question or honest answer, you want to be quick to be like, hey, I appreciate your honesty. I saw that you were just honest there. That's awesome. Thank you for that. You made it through difficult things before. Another strength. I mean, our loved ones may have gone through difficult times, even if it's times that, we might not completely agree with, but they've gotten through it. You want to point out some difficult situations that maybe they have gone through before and recognize that. Another thing is to say, hey, I know this hasn't been easy for you. I know treatment's not easy for you. I know having these conversations with me is not easy for you. Even things like that, little things like that, pointing that out and affirming the client in that can start to bring that wall down. And once you start to bring that down, you can have some genuine conversations with your loved ones. And we do this a lot in counseling and therapy. And then the next one, R for ORS, OARS. R is reflective listening. This is another thing too, is once your loved one knows that you're just kind of not listening to anything they're saying because what they're saying is hurting you, rightfully so, then we just tune each other out. And again, that wall goes right up there. And so reflective listening can be a very useful tool when we're working with our loved ones and our clients to help them understand that we're talking here, we're communicating. I'm giving you a platform. It's not just a one-way street. Like let's talk about this, And so reflect instead of fixing. One example, let's say our loved one says, nobody understands me. Well, our response as their family member can be, you feel really alone right now. I see that. I see that you feel really alone right now. And so that's an important thing to be able to reflect back to them and help them understand that, yes, everybody's listening. I'm listening. What do you mean? No, everybody's listening. You can just say, hey, look, I hear you feel really alone right now. That, I get that. And that in itself can just connect well with your loved one. And so you want to think about that reflective listening. And then the S is summaries, in ORS. And that's what we do is we help organize the thoughts. We talked a little bit about disorganized thinking and stuff like that. And so it can be very difficult for all these jumbled thoughts and situations to just kind of be all over the place. And so in counseling and therapy, we summarize and we organize everything and we help feed that back to the client so that they can start to organize it themselves and see it and have that perspective. And it helps organize thoughts. One thing that we usually could say is what I'm hearing is that part of you wants things different, but another part feels overwhelmed by everything, you know? And just by restating that and saying kind of what already is, but just saying it out in the open can really help the client be able to make sense of some of these things. So yeah, that's oars. That's a big part of it. And so, here's kind of an example of what we can do instead of arguing. We want to avoid telling them they're in denial because that again will just bring the barriers back up. And plus, if a person is denial, then it's that the actual definition of denial is not knowing that you're in denial. Like that's the thing. If they knew they were in denial, then it wouldn't be denial. It would be something else. But what we can say is it sounds like you see things differently. When you say you can share how you feel about things and have that boundary, but then you can communicate it to them in a different way by saying it sounds like you see things differently. Okay, I understand the way you see it. Here's how I see it. Let's maybe we can agree to disagree right now. Let's continue to process this and talk about our different points of view and our different sides. Those types of things. And so that's pretty much a lot of what I have for motivational interviewing. It's just kind of basic overview. The theory goes a lot deeper than this. But I do want to talk a little bit about supporting recovery. A big thing to support your loved ones is to encourage treatment. Encourage professional help, encourage treatment. Try to talk about that with your loved ones. Try to destigmatize it that it's like a bad thing or they're going to go away forever. We do that a lot. Another one is offering emotional support and healthy accountability is a big one too that we want to do. And we want to be careful about enabling. And we mentioned that earlier. So here's a couple of things that what I want to show you. MI is not arguing, it's not convincing, it's not threatening, it's not fixing, it's not controlling. It's compassionate, curious, collaborative, respectful, and hopeful. I mentioned that before. Again, curious is key here. Remaining curious, having open-ended talk with them and language, generating that communication with them, and those types of things. And core principles is partnership, acceptance, compassion, avocation, and instead of you need treatment, what concerns you most about how things have been going lately? So we want to work with our loved one, not against them. Separate the person from the behavior, lead with care over control, draw out their own reasons for change. Now, it's very simple or not simple. It sounds very easy coming from me over here, but I know in the moment it can be very difficult. Maybe we've tried some of these things before. Maybe they're just super nasty to us and we can't have these types of conversations. But I would encourage you, again, to try it again, to maybe mix it up a little bit, go out for ice cream and maybe have some of these conversations, try to work a different route to be able to have a conversation where you're not so where they're not necessarily feeling attacked, but you're also feeling like you can say what you need to say to uphold your boundaries. And there's a way that we can do that with certain types of language and how we communicate with each other. All right, so that's my pretty much most of my presentation for today. It's a quick presentation for family support. I do want to leave a few minutes left for questions and answers or anything like that that you may have, and you can put that in the chat. Great question that was just asked. What do we do when our child wants to leave treatment early? Which happens fairly often. We're working with people in our outpatient program a lot of times that might not want to complete. They might not want to stick it out, stick it through. Have an honest conversation with them. Let them know, hey, look, talk about the benefits with them. Help them understand that, it's not forever. I mean, it really, a lot of times a client, when they're in the process, it feels like forever. But then when they're at the end of it or after they finish it, they're like, wow, that just completed in a second. A lot of times we help clients understand how long they've been dealing with this challenge, to give them perspective on how long it may take to actually work through this, and that can be helpful. And then just at the end of the day, when you have these conversations, try to help motivate them and continue to stay encouraged to follow the process through. Um, be careful about enabling and hold your boundaries. That's another thing too. Is there's a saying that I've learned a while ago. I'm not exactly, can't really remember where I said it, but the pain of staying the same has to be greater than the pain of change in order for someone to change. And so sometimes when we hold our boundaries, the biggest pain generator is natural consequences. It just is. And so when we enable, we help the client to avoid those natural consequences for change. And so then change becomes more painful than actually staying the same. So then they revert back or they leave treatment early. And a lot of times when we hold those boundaries, we don't let them move back home. We don't provide, additional resources for them to necessarily, take care of certain things for a time. It helps them to really feel that pain. We want them to feel a little bit of that natural consequence. It's a tricky situation, but when they feel that pain of that natural consequence is great, then they don't want to stay the same and they want to do what it takes to change because that becomes less painful. And so I hope that helped. I know that's kind of a loaded question and it can be very tricky. Any other questions? You're welcome. All right, well, thank you so much for your time and being able to spend a little bit of time with you, talk about some things I love, and appreciate uh, appreciate everything. Thank you.
Thanks, Michael. Great job. Again, if anyone just has more questions that come up over the week, we're going to be here next Tuesday for our family support group. So thank you all for being here. Enjoy the rest of your evening. We'll see you all soon.